Hello and welcome to the Imprint Weekly Podcast. I'm John Kelly, Senior Editor of the Imprint, a daily news site covering child welfare and youth justice around the country. You can read all of our coverage at imprintnews.org or check us out on Facebook or Twitter at the Imprint News. You can also sign up on our homepage for our free weekly and monthly newsletters. And for professionals in child welfare and youth justice, subscribe to our Youth Services Insider section for a closer look at news on business, policy, and practice. The Imprint Weekly Podcast is also a member of the Safe Camp Audio Network. You can check out our show page and all of Safe Camp's other great podcasts at safecampaudio.org on the web, at Safecamp Audio on all social media. All right, it is Headlines Week, first Monday of the month, and we're going to do something a little different with this one since, being honest, it is summer, there are less headlines. But also because there was a congressional hearing of some consequence on Capitol Hill this month entitled Youth Residential Treatment Facilities, Examining Failures and Evaluating Solutions. And it came on the heels of the release of a report by the Senate Finance Committee that was called Warehouses of Neglect, which, as you might guess from that title, is a fairly scathing assessment of the residential care and treatment continuum in America. So for the many listeners who did not attend or watch this nearly 2-hour hearing, producer Christine Anjoko and I put together a set of clips that I felt kind of spoke to the issue at hand, the findings of the report, and what, if anything, might come of all of this attention that the Senate Finance Committee has kind of pulled onto this. And I would add, there was the Senate Finance Committee hearing and the report. There was a subsequent hearing on child welfare reform in the House Ways and Means Committee as well, which broached a number of different topics, including reform of congregate care or residential care. So we're going to do this. I'll link everybody to our great reporting on the hearing and on the report, and as well as a lot of recent coverage on congregate care reform. I'll put all that stuff in the show notes. But for the purposes of this podcast today, we're going to take you through 9 different clips that put together, I just felt kind of created a Cliff Notes version of the hearing itself, speaking, specifically to kind of what they found with the report, which was the product of, I think, a year or more long investigation by the Senate Finance Committee staff. I'm just going to do these clips in chronological order and riff very briefly after them, but let's start with a clip from Senator Ron Wyden's opening statement to start the hearing. Senator Wyden is the chairman of the Senate Finance Committee, and he was the lead author on the Family First Prevention Services Act, which passed in 2018, and had put in place some federal funding limits around the use of residential care and congregate care. So here's a clip from Senator Wyden's opening statement.
It seems more often than not, abuse and neglect is the norm at these facilities. And they are set up in a way that makes it happen. The system is failing, except the providers running these treatment facilities who have figured out how to turn big profits off taxpayer-funded child abuse. I don't say that lightly. Our staff spent several years looking at the biggest companies in the industry: Universal Health Services, Acadia Healthcare, Devereaux Advanced Behavioral Health, and Vivant Behavioral Health. Our investigative team reviewed 25,000 pages of company documents, had dozens of conversations with experts, pored over article after article, and saw the problems firsthand when they visited the facilities. Overwhelmingly, it's clear that the operating model for these facilities is to warehouse as many kids as possible while keeping costs low in order to maximize profit. That means intentional understaffing with persons who have zero experience or qualifications to provide the care these children need.
Okay, so 2 big things from Senator Wyden's opening statement here, and obviously he's emotionally charged about this. I was told that he spent several hours the night before and also on the day of this hearing, speaking with young people who had experienced placements into congregate care facilities. 2 big takeaways. One, he kind of verbalizes here what's a finding in his report, that his belief is that the provision of this service, right, the use of residential treatment is built on a flawed business model. He used those terms. You heard him say that it's motivated by profit. It is worth noting that 3 of the 4 major providers of residential treatment were investigated by his staff. 3 of those 4 were for-profit companies. The other one was a nonprofit organization called Devereaux. So profit is the word he uses. That is certainly kind of the case in 3 of those 4. If you are operating on his premise that this is a flawed business model and you're including Devereaux, you sort of have to make the assumption that in that specific situation, it's more about the operating margin, right? The revenue brought into the nonprofit as opposed to, making shareholders and people who own the company rich or anything like that. And then the other big thing that he brought up here is sort of like at the end, he's getting to, okay, so his view is clearly that it's a flawed business model. What is that business model? And he verbalizes that at the end. The model is to take as many kids as possible and then intentionally understaff with people who have no experience or not commensurate experience to actually be working with youth who on paper are supposed to be kids in need of pretty acute mental health help or safe and secure placement at the very least. So that's quite a charge to make there at the end. He's basically saying that this is all done on purpose. It's not just by happenstance. It's not because just of like the great resignation or anything that's happening out there in the labor market. It is intentional in his mind, and he is accusing these providers of, they are doing it on purpose. They are not hiring to the need and just filling up as much as possible. So that was his kind of first overture here. We're going to go back to back with Senator Wyden, and here's a clip not too long after that of him describing his aim for what comes next after the hearing in terms of what he wants to do with legislation and policy.
I want to work in a bipartisan way to shut off the fire hose of federal funding for these facilities to put an end to this cycle of abuse. The buck stops with this committee. In order to get a dime from Medicaid or any other program in our jurisdiction, all these facilities are going to have to start providing actual care. Systemic failures at even a handful of these facilities is an indictment of a flawed model. It's pretty simple. A facility shouldn't be getting taxpayer money if it can't prove that it's providing high quality care. Finally, none of this matters if there's not oversight and enforcement. These facilities are often located in rural areas and function as black boxes that get left virtually unchecked. As a result, practices that should be used only in rare extreme cases like restraint and seclusion are being used regularly and being used by staff that's unqualified and poorly trained. At one Acadia facility in Arkansas, restraint and seclusion was used 110 times in just a month. Without clear nationwide tracking of these facilities, this behavior just slips between the cracks.
All right, so obviously he's talking about what he wants to do after this hearing is conducted. You hear him say that he wants to work on bipartisan legislation. Of course, that's kind of the price to get in for anything, in the child welfare world. You're not going to move very far getting legislation introduced or get a hearing or get it attached to something bigger if it's not bipartisan. And then he uses the phrase shutting off the fire hose of money from the federal government to states and counties and systems that then pay for congregate care and residential care. And that would be juicy if that was something that was actually proposed into legislation. Shutting off the fire hose is obviously an idiom. They did try to do something like that with the Family First Act. What they did was basically take the Title IV entitlement, which used to be able to, states could tap into that for, funding to pay for congregate care placements and residential care in perpetuity, right? They were able to use that for any length of time to house a young person. And then that got limited down to 2 weeks. So that was, in that sense, I guess not shutting off the fire hose. I don't know what the idiom would be, making it, replacing a fire hose with a rubber hose. But then there were also, some pretty large exceptions that were written into Family First that I think it's not all said and done yet. And we'll see, where things are at in 5 to 10 years. But there's definitely concern that some of those exceptions might eat the rule And we may just, see no real major impact on the amount of federal money going to congregate care as a result of those. He also mentioned monitoring as a pursuit as far as legislation goes. I'll put a pin in that for a minute because I think there's another clip where somebody kind of speaks to where that is a challenge from the federal level to do. All right, so speaking of those exceptions in Family First, let's go to this clip from Senator Mike Crapo, who's the ranking Republican member on the Senate Finance Committee. Here he is talking about one of those exceptions, the Qualified Residential Treatment Program, and another, avenue of residential treatment called Psychiatric Residential Treatment Facilities. I know it's a lot of long names, shorthand QRTP for the first one, PRTF for the other. Let's hear Senator Crapo on that.
Our child welfare and behavioral health systems have made a lot of progress in improving the quality of congregate care settings, but clearly gaps remain. As we consider reforms to remedy inadequacies, we must recognize the different forms of residential treatment facilities, the essential role they play in the care continuum, and the regulations and requirements that are unique to each setting. For example, Congress established Qualified Residential Treatment Programs, or QRTPs, as a high-quality, clinically informed treatment option for children in the child welfare system with behavioral health needs. Unfortunately, bureaucratic challenges have prevented many states from implementing this model. Additionally, psychiatric residential treatment facilities are subject to federal health and safety standards as a condition of participation in the Medicaid program. Congress and the administration should ensure that these requirements are patient-centered, informed by best practices, and promote access for those who require the most intensive services.
So why I thought that was an interesting addition here is that Senator Crapo, and I'm not saying he did this intentionally, but he's holding these QRTPs out and psychiatric residential treatment facilities out as almost, as I was hearing it, sort of like examples of how monitoring can impact in a positive way the provision of residential treatment facilities and residential care in general. He's holding them out, right, as like higher level of care that has more scrutiny and expectations and standards around it. And certainly on paper with the qualified residential treatment programs, that was the aim of Family First, was to say you can only spend federal money on congregate care for 2 weeks, but if there are kids with high needs that really need to be in there longer, it's got to be in one of these QRTPs. That's got to be like an approved and accredited program that's really there for a kid who really needs to maybe be there for a while. So these are subsets of residential care that already have these high standards on paper. The problem with that is that psychiatric residential treatment facilities, they're probably the highest of all the youth serving residential care in terms of like standards. They're really, not that far removed from like a hospital wing. They're very secure with medical staff. I think 24/7 is like the requirement in PRTFs. There's a number of those that are in court. There are states that are in court over the quality of care in their PRTFs. There's class action lawsuits, I believe, in Alabama and North Carolina at the least. I'm sure of those two. I think there's some more. And then as far as the QRTPs are concerned from Family First, you have two studies that we've talked about on the show over a year ago that suggest kind of 2 points of concern. And I would just say with QRTPs, this is our early going with Family First implementation. But one of those studies kind of surfaced that it's an exception to the rule with federal funds that in some states, most providers have sought to get, right? So that's a bit of a red flag if you're putting something out there as an exception, but then almost every residential treatment program in the state is actually going to try and get accredited as one. And then the second report really suggested that, feedback from young people has suggested in the early going that the experience in a QRTP is not different than it is in any other treatment program or residential facility that they've been in. So I say all that to say that, Senator Crapo is correct that the standards and expectations are higher in those places, but I don't know that it speaks well to the power of monitoring when you factor in that, there are some pretty highly problematic stories and lawsuits and things coming out of those two. All right, so the fourth clip we're going to play is from Reagan Stanford. She is a managing attorney in the Abuse and Neglect Division for an organization called Disability Rights Arkansas. who has started a transparency site around abuse and neglect claims and conditions within the psychiatric residential treatment facilities in Arkansas that serve young people. So let's listen to that.
The public deserves this and as much information as possible to make informed decisions about care. So we created the Arkansas PRTF database, expending our limited resources to do what the government could and should be doing. In facilities across Arkansas, there are countless examples of abuse, violence, and neglect, such as a staff punching a child 3 times in the face, or a child being held down by peers and sexually assaulted. But it is important not to focus so intensely on cases of extreme abuse that we are lulled into believing that the issue is a few bad actors and not the model. Far more widespread is the systemic, general lack of a therapeutic environment, treatment, and educational services. There is this pervasive assumption that some children need such intensive services that they cannot be served in the community. Residential treatment is often seen as the pinnacle of treatment, the best and most intensive services a state has to offer. In fact, the most restrictive placements generally offer a level of care that could be replicated or surpassed on an outpatient basis, and that at most comes to approximately 5 hours of therapeutic services a week.
All right, so what Stanford is getting at here, I think the main overriding point of her testimony in this section that we played you is, what gets the headlines and the attention, including in this report and in this hearing, is the, abuse and neglect that, seems to occur in residential treatment facilities with far too much frequency, and how easy it seems to be to cover that up. There's another clip, I believe, that kind of speaks to that aspect of it. But what Stanford is saying here is that it's equally important to acknowledge that even if you are of the view somehow that, well, it's not ideal, and we know that kids, are experiencing bad things in here sometimes, that there are kids that need these interventions. What their transparency, Stanford is testifying, what their work has surfaced to them is that these interventions aren't doing much more, and really, frankly, just aren't doing anything that you couldn't accomplish with a kid in community-based services. So that was her view after, assessing this stuff through a transparency process and doing the monitoring that later, I don't know if it's in this clip or later in her testimony, she said, frankly, the state should be doing. And she makes a point of saying, we're doing this because the state's not doing its job. In their opinion, the abuse and neglect gets the headlines, probably not enough. But the thing that really goes unsaid is we think that these things are about a certain level and quality of treatment and intervention that, in their experience monitoring things, simply is just not true. And it's not anything that you couldn't accomplish with a child living at home. All right, and then clip 5 is actually what I was just referring to. This is Catherine Laren, who works with the Government Accountability Office, or GAO, and has led some investigative work that they've done into residential treatment facilities that serve youth. We're talking about youth that come there from foster care, juvenile justice systems, privately through their parents. So Laren in this clip is talking about some of the issues and barriers to finding out when abuse or neglect has occurred in these facilities.
With regard to the number of youth who've experienced abuse, however, we don't have good information. This is in part because federal reporting of instances of abuse is voluntary, and not all states do it, and partly because staff and residents may be reluctant to report abuse, for example, if they fear retaliation. We identified several challenges states face in protecting youth in residential facilities from harm. First, monitoring of youth placed in out-of-state facilities. Youth are sometimes placed out of state if there are no available placements in their home state, and this makes monitoring difficult because child welfare officials from the home state can't always visit regularly, and they have to rely on reports from the state where the facility is located. A second challenge is inappropriate use of psychotropic medications that affect mood, thought, and behavior. Such medications may be warranted in some cases, but inappropriate prescriptions carry health risks. Data on use of such medications among youth in foster care is limited, but historically those in residential facilities have been prescribed these medications at much higher rates. Some states have taken steps to curb inappropriate prescriptions, for example, by developing prescription guidelines.
So there's two things in here that I just kind of wanted to pull out from what Laren was testifying about. The first is her comment that reporting of abuse in facilities is voluntary to the feds, meaning the states are not obligated to do this. Some states do, some states do not. Obviously, that's kind of like a OG's moment to try and keep this family friendly here. When you hear something like that, now that would lead you to think, okay, well, that's a reasonable point at which maybe you could inject some legislation and start to make that mandatory, right? That could do that, tie 4E funding in some way to transparent reporting of abuse and neglect claims and findings within facilities. I do think that's kind of a second order thing, though, and I'm going to link to a great story that the reporter Roxana Asgharian wrote with us. We co-published with the Texas Observer about why, in my opinion, that would be potentially a productive thing, but wouldn't get to the underlying problem, which is that there is a culture of silence sometimes with how abuse and neglect is even investigated in these facilities where, if things are being suppressed in different ways, and kids are, for example, being intimidated or coaxed out of, formally claiming that they were abused or that they saw something, that's going to, even if you had some sort of mandatory scheme for reporting that up to the feds, you would be missing a lot of that. So it's a really good story. I'll link to that, and folks should read it. Laren's other point in here, she goes through a few blind spots in particular where in her experience doing the investigation, really high risk of missing what's happening with kids. I didn't play the entire thing, but basically she just calls out 3 out-of-state care, right? When you're sending a kid, not only to a residential treatment facility, which even in your state might be pretty far from where a kid lives. Now we're talking about sending them to another state to be treated. The use of psychiatric meds, right? Kids ending up on, 2 really potent psychiatric medications at the same time and all the side effects that go into that. And Laren is basically saying, that's not something that we have like a hard and true process for nationwide of kind of tracking. And then the use of restraints, which recently came up in California. There was a legislator there who wants to have basically like an open transparency process for documenting all uses of restraint within residential treatment facilities. Okay, so let's take a pause there and do a quick read. When we come back, I'll play just a few more clips from the hearing on residential treatment care from the Senate Finance Committee.
For 2 decades, Fostering Families Today magazine has educated families raising and supporting children and youth in foster care. Delivered in print or online 6 times each year, Fostering Families Today gives families the latest tips, strategies, and research on caring for children with traumatic backgrounds. Use promo code PODCAST5 to save $5 on a print or digital subscription today. Just go to fosteringfamiliestoday.com/subscribe and enter PODCAST5 to save $5 on your subscription. That's fosteringfamiliestoday.com/subscribe.
All right, we got 4 more clips to play you from the recent Senate Finance Committee hearing on residential treatment facilities and the report that they put out just on the heels of that hearing called Warehouses of Neglect. We'll drop all of our coverage and the report link in the show notes. This clip is going back to Reagan Stanford, one of the witnesses, and here she is talking about the specifics or the differences between what treatments are available and what modalities in the community versus inside of residential treatment facilities.
I think there's been this assumption that there's constant services and therapy that's being provided or time for self-reflection inside these facilities, and that's not what we see at all. It's chaos most of the time, and they're not being engaged. They're getting very little therapy. So there are lots of models out there with different types of therapy involving the families, involving just the children, but different methods and supports that could be put in place. I think what kids need is individualized care, and when you put them in these facilities, it necessarily becomes about the efficiency of the facility and not the individual care that can be provided to each kid. They're all being provided the same thing, that is what the model inside that facility is. And so just assuming that these places are providing intensive services and relying on that without looking further into what it is they're providing or what additional issues they're creating with the children is a real disservice to the children.
All right, so earlier you heard from Reagan Stanford. She was talking about generally like top line, kind of what their accountability monitoring has found in Arkansas about, just what goes on in psychiatric residential treatment facilities. Here, I just felt like she got a little bit more granular and specific about, parsing the difference between what a youth could get in the community versus what a youth could get in residential treatment. And the kind of big point that she was trying to drive home is out there in the community, there are different models, different things that you can do to tailor an actual intervention to a kid. And that the reality that they have observed in Arkansas's facilities is that everybody's getting the same thing. And as she said earlier in her testimony, that thing is not good. It's not being delivered, with any specificity to kids, and likely harkening back to what Senator Wyden said, the report surfaced, it's being delivered by workers who are not meeting the, level of experience that would lend itself to being like a very qualified youth worker and delivering kind of like, in some cases, complex mental health modalities and things like that. From that, we move to clip number 7, and you're going to hear from a few different people on here. This is Senator Crapo, basically asking everybody, all the witnesses, how to improve oversight. Like if they were going to legislate around this, how would they go about doing it in a meaningful way? So you're going to hear from Ms. Laren from GAO. You are going to hear from Reagan Stanford, who you just heard from. And then you are going to hear as well from Elizabeth Manley, who is at the University of Connecticut School of Social Work.
When we talked about barriers to getting good information about how often this occurs, a big one is fear of retaliation, both by staff who may observe abuse and not want to report it, and by residents who don't have safe ways to report abuse.
So I've only got about a minute and a half left. Could each of you take about 30 seconds and tell me how should we improve the oversight in those cases where children do need to be referred to this type of treatment? Ms. Laren, let's start with you and then move down.
Well, oversight is primarily a state responsibility. We really believe that HHS could do more to, for example, identify best practices for oversight and facilitate the information sharing among states. This is something we've recommended that HHS has not acted on.
Thank you. Ms. Manley?
As at the state level, state understanding of each of the residential interventions, but more importantly, putting intensive care coordination included for every young person who touches within residential. So there's an actual team of individuals who know that young person and spend time with that young person who can actually report back what it is that's happening.
And Ms. Stanford, I want to get to you, but I think Ms. Manley, in your testimony, you indicated that you thought that family members should be more involved at the facilities. Is that true?
Yes, they should have access to young people 24 hours a day, 7 days a week.
I think that would help get to the reporting, frankly. Ms. Stanford.
I think there could be a lot more of a focus on quality of care. Right now, the minimal federal regulations that relate to these facilities are very specific and don't overall cover that whether this place is providing a therapeutic environment or the quality of care or even the level of services that are being provided. So that information needs to be looked at and shared among states in a manner so people can see overall what these providers are providing across the nation.
So you heard from 3 different witnesses there, and you got 3 different opinions as far as what Congress might do to improve oversight. Ms. Laren starts by basically saying, well, it's states' jobs to do oversight. So that's a problem in and of itself when you're trying to legislate from the federal level. So her view was the best thing that they could do is sort of make the Department of Health and Human Services focus on best practices. And the way that you could do that in a meaningful way would be to kind of develop what everybody agrees on as best practice and then put some money behind, states that were willing to live up to that. So I guess that would be the sort of way to kind of take her recommendation. Ms. Manley's was basically to require intensive care coordination. And her reasoning for that was, I thought it was pretty interesting. Basically, the argument here is develop and mandate intensive care coordination for any, I guess the way that she was probably, she didn't say this specifically, I don't think, but basically in order to receive the Medicaid money to get that federal fire hose going towards you, you would have to guarantee that intensive care coordination was present. And why she felt that that was important is it kind of makes it so there's definitely going to be somebody outside the residential treatment facility who is very involved with that child and that child's family. And she also, in another part that I don't think I played here, was pretty adamant that another kind of key component is to, mandate or make it so that parents and family have access to kids that are in residential treatment 24/7 to reach them. And then finally, Ms. Stanford's suggestion was that when they were looking at improving oversight, to do so with metrics around the quality of care. Her point was, federal regulations don't really get to the level of services or what's actually being produced. It's much more about just sort of the conditions around which they are provided, but it doesn't really get to is this helping anybody? From that, we go to clip number 8, which is sort of related. So, that was a discussion about how Congress should go about doing oversight. There is a federal agency with oversight over the funding that goes out from the Medicaid program, and that is the Centers for Medicaid and Medicare Services. And this is a clip from the response from Ms. Stanford when asked by one of the senators, what their experience has been, what Ms. Stanford's experience has been in Arkansas with CMS's oversight practices as it relates to residential treatment facilities.
I'm curious if any of you have any involvement with CMS and information that we need to be aware of as we are working with that federal agency as well.
The one thing that I would say is that CMS does have the ability to cancel a contract if a facility, particularly a psychiatric residential facility, is not meeting their health and safety standards. But when we looked at this in 2020, during that year, they had not exercised that authority even once.
Well, and I think, Ms. you said there's limited CMS oversight and regulation. So do they have the oversight and regulation, or they don't, or they have it and they're not exercising it? I'm curious.
I think both. There's very narrow regulations that are applicable to these facilities. So they're kind of pigeonholed into these very narrow things that can't look at the broader quality of care and what's going on and how services are being provided. But they also, even in our state, sometimes, they're doing a better job at documenting what's going on, but that's it. There's no progressive discipline that's documented. You can look at the surveys, you can see that they've found things and that the facilities have come up with these rote plans of correction that are usually retraining staff by the administration that is already in there and was probably part of the problem to begin with. And then that just keeps going on and on. Every day is a new day. There's no actual sanctions. No matter what happens to kids, no matter what goes on, there is not any actual financial sanctions or any kind of sanctions, at least in Arkansas, to any of the facilities.
So fairly pointed response here. CMS has the ability to do things. They could cancel a contract if they wanted, if they felt like the facility providing it or the quality of the care wasn't good. They don't, is what Stanford's saying. And even when they do find bad things happening, what she's saying is that they deliver, essentially a slap on the wrist. I think the sort of example she gives is, requiring the leadership of a problematic residential treatment facility going through training. And she says every day is a new day under CMS oversight. Now, to be fair, CMS is a notoriously overburdened and very small staff, and they have oversight over these massive entitlement programs like Medicaid and Medicare. So I do think it is fair to say that not only is it a good idea to scrutinize the process that which CMS delivers oversight here, just more broadly questioning and finding solutions around whether or not they are equipped to do oversight of the many different things that happen within Medicaid. Last clip that we wanted to play, we'll come back full circle to Senator Ron Wyden. We played his opening statement. Here is what he had to say as he gavelled the hearing to a close.
I look out over the room. I see the survivors and the families, and I heard comments last night, and I heard comments this morning, and I've read a number of your accounts. And I just want you to know that you have not made this trip thousands of miles to Washington, D.C., just to hear us talk for a little bit and call it a day. You have laid out a blueprint for the kinds of changes that are necessary. These efforts, for example, for more home and community-based services and the health and safety issues that relate to Medicaid and child welfare rules. So I want everybody who's going to be faced with going back thousands of miles home to know that we are not just talking today, This is the first step of what you need to do to make change. I'm going to do everything I can as chairman of this committee to get a bipartisan approach going, and hopefully we can have it up and running in the fall that focuses on the issues we're talking about today, which is beefing up health and safety for vulnerable kids and vulnerable families.
So in closing, Senator Wyden there essentially tells the many young people who attended the hearing, who met with him before it, the night before, the morning of, essentially that this trip will not be made in vain, and that they were not just here for a dog and pony show, frankly, which I think it's, certainly become a common criticism that young people are trotted out to, testify to some aspect of the system, and then, legislation either doesn't happen or it doesn't help or whatever is the case. I thought it was kind of notable that, there were meetings with young people to inform Senator Wyden, certainly to inform the report, but that they were not, put out there at the hearing to tell their individual stories at the hearing. It was all done to inform things, in advance. Now, of course, Senator Wyden can't promise that anything is going to come of this. I do believe that he cares deeply about this. He's been focused on child welfare issues for a long time now, and it's not really, an issue that you take on to, improve your profile if you don't care about it. It's a system that I've been working on the coverage of for a long time. It is largely ignored. I think it's certainly, we see much more coverage of child welfare and much more robust coverage of child welfare in different ways now than we have in the past, but it's certainly not something you take on to raise your profile as a politician, in my opinion. But we'll see. We'll see if he has, interest, I think, from Republicans on the committee, from Republicans and Democrats on the House Ways and Means Committee, and where are they really willing to go in terms of exploring what power the federal government has. My personal opinion, I think that going back to his comment about turning the fire hose off, that is certainly something that they do have power over. They have power over federal money. When it comes to the monitoring and things like that, as Ms. Laren said during the hearing, most of that lies with the state. And so it's kind of a bank shot. You have power over money. You can tie money to monitoring. And then you got to make sure, since it's now a second order kind of effect thing, that anybody's actually living up to it, or are they just saying they're going to do different monitoring system change and grabbing that money and not doing it. So I'm kind of rambling here, but I guess, I think it's obviously good that he spoke directly to the young people who attended that hearing. But I guess it's as always with federal policy, it's a we'll wait and see to see if they actually can move the needle past where things are, which I don't think there's a lot of people who feel that there's more to be done to regulate this system, and in particular, the provision of residential treatment and congregate care. All right, that will do it for this week's episode of the Imprint Weekly Podcast, which is a production of the Safe Camp Audio Network, which is a division of Fostering Media Connections. Please visit safecampaudio.org on the web or at Safe Camp Audio on all major social media. This podcast is produced and mixed by Christine Anjoko with music by Luke Giroux and Cyrus Elia. If you enjoyed this episode, we'd love it if you'd consider subscribing or giving us a 5-star rating on Apple, Spotify, or wherever you download your podcasts. And that is my little foster dog, Paprika, lapping up water in the background as I do this. And we'd really appreciate if you would support our work here on the podcast and in print. Small donations from our listeners and readers go a long way towards helping us grow and cover more great stories in child welfare and youth justice. To support us, it is very easy. You just visit imprintnews.org/donate. You can follow The Imprint on Twitter and Facebook by searching the handle @TheImprintNews and visit us on the web at imprintnews.org. You can always get us on email at tips@imprintnews.org. I'm John Kelly, and we'll see you next week.